Well, hello, everybody. Welcome to the Monday, August 15th, 2022 meeting of the Health and Human Services Committee. And we are going to get started. I'm going to say a few little things before we start, and then we'll dive right into the agenda. So the first thing is that we have a very full agenda today. So we may or may not be able to get to all the department updates. So department heads, if there's something you really want to make sure gets said today, then go ahead and be assertive and make sure at some point what you need to say gets said, or either that, or maybe we will have a chance to check in with everybody. I'm not sure yet. The second half of the meeting is the presentation from the presentation about Tides, the homeless encampment proposal. And, you know, that could be a very big discussion. The last time they were here, the discussion went on, as I recall, for an hour and a half. We're going to try to rein it in slightly so that it doesn't go as far. I'm asking the participants here to try to limit the discussion to asking questions, clarifying questions to make sure we understand what it is that's in that proposal, but that we're going to try to avoid discussing the merits of Tides to the extent that we can. I'm also going to we're going to spend some time at the end of the presentation to discuss what the next steps for the county would be. And I'm going to make the recommendation that the next step for the county is that we, the county, talk among ourselves to make this decision. I'm going to ask the county administrator to convene a meeting of all department heads that are relevant to this proposal to discuss it and to see what's really involved at the county. By the county. So I'll repeat that again when we do that later on. I'm just setting you up right now to remind you that we're not going to do a debate on whether this is the right thing to do or not. That's not quite where we're at yet. And the last thing I want to mention before we start is that I'm going to do my best to end us by 5 o'clock. So that's 2 full hours. I really don't want to go more than that for a couple of reasons, but I just wanted to try to set those parameters out now. That should give us plenty of time to talk about everything we need to talk about. Hope that all sounds okay. And let us continue with the agenda. And the next one is changes to the agenda. I don't think there are any changes. Is that correct? Thank you, Katrina. Next thing is public comment. There's nobody in the chamber with us now. Is there anyone on screen that is here for public comment?
I have not received any requests.
Very good. Thank you. Then let us keep going. I don't have any chair's report other than all those little introductory remarks that I made already, which is going to lead us right into our first part of our meeting, which is a presentation from Melissa Perry, Executive Director of the Child Development Council, and talk about childcare in Tompkins County and in some broad strokes and also some particular projects that they're thinking about. And Melissa, take it away.
All right, wonderful. Hi, everyone. Thank you. Thanks, Dan, for that introduction. As you mentioned, my name is Melissa Perry, and I am the CEO at the Child Development Council, and I'm excited to have this opportunity to talk to you about the state of childcare in Tompkins County. I do actually have a slideshow, and I'm wondering if I have permission to share. Hopefully I can.
Yep, you should be all set.
Okay. Well, give me just 1 second. This is coming out. There we go. This is my first time using Canva. I don't know if others have used it, but it's pretty amazing. It makes a snazzy presentation. All right, let me jump in here. So, state of childcare in Tompkins County. So the first thing I wanted to share with you is a quote from Mildred Warner, who is a Cornell professor of city and regional planning, and you'll be hearing a little more about her later on in this presentation. But I'll read this here. So by investing in childcare, we're supporting the economy in the short term by meeting parents' needs, allowing them to work and contribute to the economy. Investing in quality childcare and early education contributes positively to children's development and ensures the future of our economy. By investing in childcare, we build the social infrastructure to support the broader regional economy. And I know a lot of that is, heavily geared towards economy, which is definitely in her wheelhouse, but there's three big things that stand out. It's really, childcare is important because it contributes to the positively to the children's development and sets a foundation for lifelong well-being and learning. Parents get their needs met, they're able to continue with their work, which, builds satisfaction for them and they can provide for their families. And of course, that also contributes to our economy as well. So it really is critical infrastructure for the well-being of all parties involved. And this is where I share the bad news. So Tompkins County is a childcare desert. And so 2/3 of the children in Tompkins County, age 5 and under, do not have access to licensed or regulated care. So that's a big concern, because where are those 2/3 of children and how is that impacting the development of those children, those families, and our community as well. So to qualify as a childcare desert, an area has to have either 50 or more children age 5 and under with no childcare providers, or an area with more than 3 children for every available childcare slot. So as I mentioned, 2/3 of our kiddos in Tompkins County do not have access to that care. So it's not all doom and gloom. The Child Development Council, that's what we're here for. We are here to support childcare and families who are seeking childcare and those childcare professionals. So the Child Development Council is a childcare resource and referral agency, and those are all over New York State and nationwide. We are the CCR&Rs, we call it, for both Tompkins and Cortland counties. So we act as a resource hub for families, for childcare professionals, employers, and of course the community as well. So a resource and referral service, if families are seeking childcare, they're reaching out to us. We keep a database of all of the childcare providers in both Tompkins and Cortland counties. So families can give us a call and let us know a little bit about what type of childcare they're looking for. What age is their child? What area are they seeking care? Is it near their home? Would they prefer to have someplace that's closer to their workplace? Those sorts of things. And so then based on those criteria, we can give them a list of the child care providers that would possibly meet their needs. We are not able to give recommendations for childcare. However, we do provide families with quality care indicators to look for. So when they're visiting a program or speaking with a provider to see if it could be a good fit for their family, we are giving them a couple of things to look for. Mainly, when you're visiting, what is the ratio of children to care providers? You want to make sure that's as low as possible, and certainly within regulations. What does the space look like? Is there outdoor space? What does the schedule look like? Is there a mixture of structured play and unstructured play? And would that philosophy of that program fit the needs of your family? So while we can't offer those recommendations, we can tell families a little bit about what to look for. We are also able to offer emergency scholarships for families who have experienced an unexpected expense or loss of income. So they can submit a request for a scholarship to us, and it's actually our referral specialists who handle the emergency scholarships as well. And our referral specialist will have a conversation with them and make sure, first of all, that they know what other resources are available to them. Whether if this is a long-term need that they're not able to afford childcare. It's a little noisy out my window. Lots of fire trucks. Okay, sorry about that. If it's a long-term concern that they're not able to afford childcare, we want to make sure that they know about the childcare assistance that's available, which was formerly known as childcare subsidies to help pay for childcare. And if we are able to approve their request for an emergency scholarship, that payment is made directly to the childcare provider. And then another way that we support the community and families. So we provide information for employers on how they can support childcare needs of their employees. So there's a few different ways that they could do that. And we actually have some information sessions coming up Wednesday and Friday morning of this week, where our team will be presenting in partnership with a few other organizations about how employers can support this. And I'll give you a quick sneak peek of that. So providing dependent care reimbursement for dependent care costs, that's something that employers can offer to their employees, or an employer could sponsor a family or a group family childcare, and that provider would then agree to hold slots for the children of employees who work at that business or an organization. And then, of course, an employer could sponsor a childcare center on their premises, so their employees have easy access to that type of care for their children. So other ways that we support childcare, supporting those who are providing the care, so childcare professionals. And we do prefer to call them childcare professionals rather than childcare providers, because they very much are professionals. A lot of them have a lot of education, and they deserve to be recognized as a professional for the really important work that they're doing. So ways that we're supporting childcare professionals, educating and supporting them through the licensing or registering process. So a licensed childcare facility is one that has more than 6 children. If there are less than 6 children, then they're a registered program. So helping them understand those differences and what would apply to them and what they need to do. We offer training on business and best practices. We offer monthly and quarterly roundtable events, so information that's coming from DSS or Offices of Children and Family Services. We make sure that all of that information is shared with all of our childcare professionals, so we're all on the same page, and then we can have a discussion. And if there's questions, we could be the ones to be that go-between between the childcare professionals and OCFS or DSS. We also offer training hours and network opportunities for childcare professionals to share their ideas and really build a network of support, so they have that peer support with one another. We distribute grants and provide support on how to first apply for those, and then if they receive the funding, how to spend that funding within the specified criteria. We offer environmental assessments for programs to ensure that they are offering high quality early learning environments, and that very much is a partnership with the childcare providers. So we are going in and inspecting and assessing their spaces, and then with them, based on their goals, we make a plan to help them improve their spaces. And something that's brand new that we're doing, and we're still in the planning stages, and we're going to be rolling it out this fall with the Tompkins County Child Care Centers, is a new project called Ensuring Equity and Inclusion in Childcare that we've developed. So this is really, it's another assessment, and we'll partner with these childcare centers to really review how inclusive their childcare programs are, from the curriculum that they're using, the holidays they celebrate, the stuff that they have taped to the walls, the materials they're using, their parent handbooks. So really assessing their programs to make sure it's welcoming for everyone. It's the children they're caring for, their families, and even the staff that are working there. So definitely we'll be excited to share more information about that as we get that out and going. And advocacy is another huge piece of what we do. And we're huge proponents for universal childcare because all families and children should have access to quality, affordable childcare if they want it, that is diverse and meets their needs. And if we had universal childcare, we probably wouldn't be having this conversation, but we'd be able to focus on much bigger things. And then, of course, we're always advocating for higher wages for our early childcare professionals. They, as I mentioned, they're doing one of the most important jobs there is out there, and they are among the lowest paid workers. And they're working really long hours as well. And then, of course, diversity, equity, and inclusion and belonging in early childcare programs, curriculums, and learning resources. So I want to talk to you a little bit about building access to childcare, and it's certainly going to the next part that I want to discuss with you will really build on this piece of it too. So we developed building access to childcare about 4.5 years ago in order to build and really build the supply of childcare in Tompkins County, knowing that we are a childcare desert here. We really need focused attention to increase the supply of childcare and protect the existing supply of childcare. So we did this as a pilot for the first 3 years. And then when we had the opportunity to apply for more funding, we decided we really wanted to hone in and just focus on the 3 aspects that were the most successful from that pilot program. And those are attracting talent, offering individualized support, and offering business assistance. So attracting talent, we offer Become a Provider workshops for those who are interested or want to know more about providing childcare. We bring them in or offer them on Zoom and really, give them all the nitty-gritty details of what it takes to start a childcare program, get them up and running, just the realities of it. Our experts are here on hand so they can get all their questions answered. And I actually have a number. So we've had 45 people participate so far in 2022 in those sessions, which is pretty great. So when somebody decides that they want to provide childcare, they want to take that leap, we offer individualized support to them. We have a staff person who partners with this new provider or up and coming provider and really walks them through the process, whatever they need. We're in their homes or where they're proposing to provide childcare. We help them set up the space to make sure that it's developmentally appropriate, it's a stimulating environment, it's safe for the kids, just setting them up for that long-term success. And then we also offer business assistance to childcare professionals. So a lot of them, they're experts in caring for kids. They understand child development and all that comes with that. Most of them don't have degrees in, accounting or, business degrees. So that's where we come in and offer that technical assistance to them. We can help them set up their budgets. We can help them, take their childcare philosophy and really get it on paper and make sure that translate into their parent handbooks or their program policies. So again, kind of taking a little bit of that off their plate and providing that support to them to set them up for long-term success. And building to access to childcare has been successful. In the pilot, we had 4 new programs that opened up. Those 4 are still running. One actually just expanded they were a family provider, now they're a group family provider. And we have 4 more that are in process right now as well over the past year. So that's pretty incredible.
Melissa?
Yes.
Before you move on from that one, I just wanted to make sure that everyone was aware that this is a county-funded program.
Yes, it is.
We had, as I recall, we had done an OTR for 3 years running, what you're calling the pilot project. And then last year it became part of our target budget. So just wanted everyone to be aware of that here, that this is our funding.
Yes,
Thank
yeah,
you.
that's correct. Thank you. Yeah, so we definitely appreciate it. It's making a difference for sure. And then I want to move into, so I know the community recovery funds, there's this opportunity to apply. And I know that childcare is a priority. And really the Child Development Council, we're very uniquely positioned to, propose this transformative project to really impact the scope of childcare in Tompkins County. And it's building off of the services we offer as a childcare resource and referral organization, and also our building access to childcare. We have a lot of relationships already with people who are interested in providing childcare. And now we really need the funding to help get these programs going. I mean, there's no question about it. Not having funds is a huge barrier to some people being able to start childcare programs. And there's really not the funding out there to do it. So I want to kind of give you a sneak peek of what our proposal will be for the community recovery funds. And I definitely appreciate the opportunity to talk about this. And I'm happy to answer any questions when we're done too. And of course, there'll be a lot more detail in our proposal. But knowing that this opportunity was coming up, we spent the spring semester working with graduate students from Cornell, so Mildred Warner's City and Regional Planning Program. They worked really closely with us to do some research and to come up with some ways and really, get them organized in what is the best way to support childcare, the development of childcare, and then protecting the existing supply of childcare in Tompkins County. And these are what you see on the screen are some of the main points that we've come up with. So the startup costs for new programs, it's such a big barrier to starting a new program, especially starting a new center. It can range anywhere from a couple of $1,000s to $50,000, depending on the modality of care that you're providing. So we want to be able to, we're offering support. We're, the manpower to get these programs up and running and the expertise. They really need funding. And we would like to be able to do that to support those programs. And then expanding existing care. So family daycares. So I'll tell you a little bit about family daycares. That's care that's provided to 6 preschool age children or younger in a primary residence. And then they can care for a couple of school age children before and after school or during breaks. So a lot of those family daycare providers are very unique. They are interested and ready to expand into group family care. So essentially that means they hire an assistant and then they can care for up to 6 more young children and then a couple of more school age children. So a lot of them are ready to do that and interested in doing that. But there are costs that come along with that. They may have to do some minor construction projects on their home to make sure the space flows better, because now you have more children that you'll be providing care to. You may need more materials such as appropriately sized furniture, more toys, educational materials that they can be interacting with, or maybe a fenced and an outside play area. So those are ways that we could support the family daycares in expanding. And then it's very similar for center-based childcare. We have some programs that received regional economic development funds already, and they're, but it doesn't cover the costs of their expansions, but they're ready to go. They have the plans drawn up. They're ready to do it. They just need more funding to be able to do that. And we would love to be able to support those projects because it really would impact the availability of childcare in Tompkins County. Also, childcare scholarships, I talked a little bit about that before. What I didn't mention is that we're only able to offer that when we have funding, and we have to write grants or rely on donations to be able to offer those scholarships. And, those scholarships are critical to ensuring that children get to continue in their care setting, and that families stay employed. If you can't pay that childcare bill and you lose childcare, usually that means you're losing your employment as well. And then families are just deeper in the hole when we could help them with those short-term things. And it would be excellent to have a source of funding that we could pull from, so we're not so focused on always trying to seek out donations or write grants in order to be able to offer this service to families. And then, of course, to make sure this great work happens, and we're looking for someone a childcare developer or planner to facilitate this work, who could be there for that source of support for these new programs, or these programs that are expanding, who have the unique understanding of the regulations of childcare and the language of childcare, while also being able to talk with builders and inspectors about these construction projects, or city planners. So it's a really unique position that would take a lot off the plate of childcare professionals and center directors who, they're so focused on the day-to-day of making sure that kids are well taken care of, that oftentimes they don't have the time to make these things happen. They don't have the time to look for write grants. And that's something that we would be able to offer them and support them and really strengthen the supply of childcare in Tompkins County. So I know I've just shared a whole bunch of information. I'm really happy to answer any questions or open anything up for discussion with all of you. I definitely appreciate this opportunity to have this conversation and share a little bit about what's going on in Tompkins County.
Thank you, Melissa. I'm going to ask you to expand on one thing you said, and then I'll open it up to questions, anybody else that wants them. You mentioned a little bit about REDC, Regional Economic Development Council, money that was acquired for some projects. Are you able to talk about what specific projects that was allocated for, and a little more about how that all works and what might need to come next to bring those projects to fruition?
So, gosh, let me see if I remember off the top of my head. So Coddington Child Care Center was one that received funding. The YMCA was another project that was funded to increase child care. I believe IC3 also received it. And I believe there was one more, but I cannot remember off the top of my head. So they had applied for that funding, and those programs did receive funding in order to expand or improve their programs. So we would like to support them in being able to follow through on that. I do know that at least one of those was not able to complete the project, so they won't be using the Red Sea funds right now. But there are others that are still, they're still there, they're ready and waiting. They just need more funds in order to get these projects completed.
They received a substantial grants from the state, but that's just a percent of what they need to finish, and they need more money. Is that kind of accurate?
Yes, absolutely.
Great, thank you. Okay, any questions for Melissa? Questions or comments? Mike.
I've got a couple actually. So we have about almost 4 years worth of data now. I'm not asking for the metric of how many beds we had 4 years ago, not beds, but how many spaces we had compared 4 years ago to what we have compared now, because I don't think that would be a fair comparison. But how many have we actually created over that time? How many, not have we created, how many have been created, I guess, over that time period? I don't know if you have that kind of data.
I do have that. Yes, I don't have it handy right now.
Excuse me a second, Liz. I just want to ask, you're asking about the position that we're funding. What slots has that created, or just overall? How many?
I think overall.
Okay. Thank you.
I mean, well, yeah, I mean, really, it's more pertinent about, I'm kind of wondering how effective we are. I mean, if we're doing this, and the good thing about that number will tell me too, like, what's the most effective way to create this? And that might just be a question you can do without data. I mean, is it more effective to create as many people taking care of 5 kids? Or do you go bigger like initially? I don't know the answer to that. Maybe you do know the answer to that. I don't know.
Sure. So we have found that the best way to increase the supply of childcare is really focusing on those family daycare programs. So that is a home that is a program that care is provided in a primary residence. Usually the caregiver is the one living in that residence, but someone else could live there too. So they can provide care for 6 younger children and then up to 2 school-age children. And we have found that that is the most effective way and really the easiest way to improve the supply of childcare. And that's our building access to childcare that's funded by the county. We focus on that because that is the best way to increase the supply. And then also, once someone is an established family provider, we encourage them, if they're interested, to expand to a group family provider. So that means still providing care in a primary residence, but they can have up to 12 young children. And then after older school-age children after school or on weekends, as long as they have an assistant when they have more than 6 children. So those are the easiest ways to expand childcare. Opening up a childcare center it's huge. It's expensive. It's a very lengthy process. You have to have someone who's willing to hold the license. That's probably the most difficult one. But if you have an existing childcare center, expanding that childcare center is fairly reasonable. It's still much more intensive, both resource and time-wise, than expanding from family to group family, but it is possible. So it's really getting those new family providers in, helping them expand if and when they're interested, and then expanding our existing childcare centers as well. And I'm definitely happy to follow up with the numbers, the increased slots. I know it's at least 32 from our building access program. So I can get back to you. I'd be happy to share that information.
That'd be great, Melissa. Thank you.
Sure. Yeah, you're welcome.
You mentioned sometimes these buildings need some construction to make them. Do we have a building fund in place for that? Is that something that you would find useful?
That would be incredibly useful. So, a lot of people have heard about the stabilization funds, the child care desert funds that have come down to support childcare. None of them really focus on construction for spaces. Some offered minor repair funding, but really not that construction that would help, help a lot of people meet those regulations or really transform that space so it was usable.
Okay, thank you.
Mm-hmm.
Randy.
Yes, Melissa, thank you for the presentation. Have you also looked at, for the child care centers and the family-based and the family group, an idea of what it costs for daycare? It'd be nice to see some of that information just to put it in perspective. My wife was a daycare provider for 15 years, mm-hmm. and she kept it to 4 just because for sanity purposes. But she was shut down because we started watching a child who was getting some financial assistance, and because we didn't have another exit out of the second floor, they shut us down. And the teachers the kids that my wife was watching for less than going rate were not very happy with how that turned out, even though we agreed to then just leave all the children on the first floor. They said that was still unacceptable. That was 7 years ago. I don't know if that's the type of thing you run across again. But I would imagine that generally family-based are less expensive. Is that probably true?
Yes, that is true. So family childcare and group family childcare is typically significantly less expensive. It's also pretty desirable for families, especially during this time. because it's a smaller group and a lot of families are looking for a more homey, just, a small cohort of kids for their families to, or for their children, to have that. So yeah, that's definitely less expensive and more desirable. And I do have the information about what it costs to, that was part of the research we did about opening up programs or expanding programs. So that will certainly be shared in our community recovery fund proposal for everyone to take a look at.
Thank you.
Sure. Yeah, thank you. Oh, sorry. I think Kate has her hand up too on here.
Yes, Kate Shanks Booth, the Department Head of County Youth Services. You're on.
Yeah, thank you. Yeah, I just wanted to add a lot of those desert childcare funds that came down, and some of the others were really earmarked for new programs. So if you were a program that was currently in existence or currently had a license, you couldn't apply for those. And so there has been several funds that have come down, but there's a lot of hoops that have to be jumped through, and they're not very applicable to some of the holes that we have in Tompkins County. And I think the in-care home care is really desirable. It really allows a lot of flexibility. It is cost prohibitive to start, and keeping up with all the regulations that you have. I think Randy, your example of that additional door, is a perfect example of what can happen. And so having a fund where you could help, help these entrepreneurs, right? You're creating wealth, you're creating great change in some families' dynamics, and really giving them, sustainability in a way that maybe they couldn't do otherwise. I think it's a great thing. But I just wanted to add that. And the other thing too is that anytime you do infant care, it's not where your money's made. A lot of that is your money is made in the older care, your school age care, because it's so cost prohibitive to have infants, and even in centers, it's one to such a small ratio of kids. And the requirements that they have, the education requirements, really, that's the other thing too, is that you have to keep in mind how many youth under what age and how old people have. So the expansion, especially having more school age kids, would be desirable for some of these home care centers, because it would help actually make it profitable and something that could last a little bit longer. So
Right.
Just want to throw those out there.
Yeah, thank you, Kate. And I can jump in and share a little bit about the desert funds, since Kate brought that up. It's definitely applicable. So the first part of the child care desert funds, we had 13 people apply between Tompkins and Cortland combined. Cortland did not get any awards. Tompkins received 3, but unfortunately since then, 1 has been deemed ineligible. So that's only 2 for Tompkins County. And it was those 3 had a combined total of $242,000 in assistance that they would receive paid out over 7 or 8 quarters. So unfortunately, that'll be less funding, of course, since 1 has since been deemed ineligible. And also, unfortunately, those funds are not guaranteed to stay in Tompkins County. They will be redistributed throughout the southern tier. So there is hope that there's 2 new programs starting up, which is great. And then the Child Care Desert Funds 2, so that is open to current existing providers who were licensed. I believe it's as of January 28th of this year. So they're licensed as of January 28th of this year, and they can apply for those funds if they agree to open up some spots for infant, toddler, or special needs care of children with special needs. So they will be able to get some funding to do that. As Kate said, providing care for infants, you will never be able to recoup the cost of care for that, because it's so expensive. And really, the older kids are where people make money, but infant and toddler care and care for children with special needs is there's nothing. You can't, the stock of that is so low, it's almost impossible to find care. So that's why they are encouraging these existing programs to offer some slots, and they're monetizing that. They're giving them this funding, so they will increase the supply of childcare for those particular pockets of need.
Thank you. Other questions for Melissa? Veronica?
Thank you. Thank you, Melissa. This is really exciting. All the both the ongoing and proposed work you have, especially the idea of getting a childcare developer or planner. If I'm understanding right, that someone in that role could help with the situation, such as like what Randy described his wife running into? Or
Yes,
just the barrier?
right. We could do that. Our existing CCR in our program could probably help with that too. And maybe there was some conversation. I wasn't with the council at that point. But yes, anyone here, if anybody has questions about childcare, no matter what it is, childcare providers, anything, we are here to support them and would definitely help address that issue.
Yeah, thanks. And not trying to talk about your specific situation, but this is not the first time that I've heard like something like that happening. And then just a curiosity question for the counting of 2/3 of Tompkins County children aged 5 and under not having access to licensed or regulated childcare. How is that counted? Or like how are, say, stay-at-home parents counted in that?
Right.
Just kids who need care or just all kids?
That is all children. Right. All children 5 and under in Tompkins County. So stay-at-home parents would not be counted as providing care for their kids.
I know this might not be countable, but do you have a sense of like what proportion of kids or how many are like, like have stable care from a family member in a way that's like working well for the family versus they don't really?
I'm not sure. I think I would have to look into that more and I'd be happy to get back to you. I know that we offer surveys, parent surveys, and childcare professional surveys, but I don't know if we've phrased it exactly in that way before. So I would be interested in that information too. Thanks.
Thank you. Any other questions or comments for Melissa? Okay, well, thank you for all that info about childcare and the childcare situation in Tompkins County in general and some of the specific things that the county is or might in the future be involved in. There's a lot going on. There's some potential big infrastructure developments. That means more childcare slots. There's a lot of ongoing small accumulation of childcare slots. It's all good. It all adds to the total, right?
Right. Yes, definitely. And thank you again for this opportunity to talk to you. Please reach out. I'm always here. So happy to answer any questions, and I'll certainly get back to those people who asked some questions that need some follow-up.
Okay, well, thank you again.
Thank you.
Next on the agenda is the county administrator's report. Lisa Holmes, you're on.
Hi, Dan. Thank you. I don't have a report today, but I do have the resolution for consideration that the transfer of the employee health and safety coordinator from the health department to county administration.
Thank you. Somebody want to move that? Put it on the floor. Randy moves, Veronica seconds. Thank you. Lisa, do you want to say more about it?
I can just summarize briefly. This position has been at the health department for many years. It was seated at the health department because we used to be able to draw down state reimbursement for this position. It's been many years, maybe a decade or so, since we've been able to draw down any reimbursement, and it does not appear that we will be receiving any in the future. At the same time, the position serves all of our departments in the county. There are times at which information of a confidential nature is brought forth through this program, and it is more suited to be in county administration, in a confidential type department. So it's for those reasons, and also the fact that we are seeing more incidents surrounding workplace safety, elevating it to county administration so that it can function across all of the departments. This seems to make sense at this time, but it's something that The current health and safety coordinator found another position, and while we are searching, we thought this would be a good time to move it over. And this was at the request of the department head, Frank Krupa.
Thank you. Any questions or comments about this topic? Okay, let's have a vote then. Travis,
Yes.
Veronica,
Yes.
Randy,
Yes.
Mike,
Yes.
and I'm a yes, that is unanimous. Thank you, everybody. Thank you, Lisa.
Thank you.
Anything else for us?
Nope, that does it.
Okay. All right, next up then is Department of Social Services. Kip Kephart. Hello. Welcome back from your vacation.
Hi, thank you.
Happy Monday.
Glad to be back.
Okay, Kate, you have a resolution for us. Do you want to tell us anything about it before we put it on the floor?
Sure. So this is money that is coming through OTDA. We're pretty excited about this as we look forward. And no, we don't look forward to it, but we are looking ahead and anticipating increased evictions as the rental, currently the ERAP program, the Emergency Rental Assistance Program that has been in effect. We are hearing that at some point the state will close that program down. Currently, there are many people who have applied for those funds through the ERAP program that are causing any evictions. As long as the people have applied for it, they're causing evictions to be set aside. But eventually that program will come to a conclusion and we're going to see increased evictions, we anticipate. So when we were informed that this rental supplement program was available for districts through OTDA, we were excited about it. It will bring about a $460,000 currently to our county. It does come with a 15% local cost. But I think that, on the whole, this is going to be a huge help to us. It's state money, so it does not require us to stay within the HUD guidelines. We can help people more broadly. It's there to help people who are facing, evictions, homelessness, who are currently homeless, or who are at imminent risk of losing their housing. So it's got a lot of ways that we can help folks. Currently, we're anticipating that we would be, we're asking, the reason why the funds don't match up with the full annual cost this year is because we're anticipating that we would be trying to spend about 3/4 worth of funding in the rest of this year. We just received approval for the plan within about a week ago. So we would be looking to spend that money this year, and then we are being told this program will be ongoing and we will get additional funds in the future. So it does require that local match, but we are excited to receive it and hoping to go forward with it.
Thank you. Can I get someone to put this on the floor? Veronica moves it. Is there a second? Mike seconds it. Thank you. Discussion. Veronica.
Thanks, Kit. So the spending about 3/4 of it, what happens to the other quarter? Are you saying that we could maybe spend that in 2023 or beyond, or do we just lose it?
No, so we are anticipating that they're going to approve. So the way that this works through OTDA, currently what they're saying is that they anticipate that we'll be able to spend into 2023, but they're still waiting to look at what happens statewide with these funds. So we don't know whether that money will kind of be extended or whether it'll get rolled over into the allocation for next year. We don't know at this point, but we're hopeful that one way or the other that we'll be able to utilize it.
Thank you.
Other questions or comments? Ready to vote then? Mike?
Yes.
Randy?
Yes.
Veronica?
Yes.
Travis?
Yes.
And I'm a yes, that is unanimous. Thank you, everybody. Thank you, Kit.
Thank you.
Kid, anything else you wanted to tell us before we move on?
I don't really have a department update at this point, because I was away last week. But we're chugging along. We're just moving ahead with this program and others. So that's all I have. Thank you.
Very good. Keep chugging. Thank you. All right. Next up is Office for the Aging with the resolution, budget adjustment, true creative digital images and documents, Office for the Aging. Is Lisa here? Oh, Karen's here. Hi, Karen. Karen, I think you're muted.
I am muted, sorry.
No
Yeah,
problem.
Lisa's off today, so you have me.
Excellent. Well, let's get this resolution on the floor, and then if you want to say something about it, you're welcome to.
Okay,
Randy's going to move it, and Veronica's going to second it. Okay, Karen, you're on.
okay, so this is a budget adjustment for us to essentially purchase our resource guides and our logos from the company True Creative, who helped create them. What we had been doing in the past is paying True Creative on sometimes more than once a year basis to do all the edits to these documents. But by purchasing them directly, we will be able to have them and edit them through our communications director, as he now has the software to do so.
Any questions or comments for Karen? All right, let's have a vote then. Travis,
Yes.
Veronica,
Yes.
Randy,
Yes.
Mike,
Yes.
and I'm a yes. That is unanimous. Okay.
Thank you.
Karen, anything else you wanted to tell us about?
Nope, I have no updates today.
Okay, well, thank you.
Thank
for
you.
coming. Next up, I'm going to go around the department updates just for a minute. We have some appointments, advisory board appointments. Let me read the little list here. These are all appointments to the Human Rights Commission. We have Ben Sternbank, Ruth Williams, Teresa Fulton, Lady Ajayi, and Lirianne Gonzalez. Does anybody want to move these? Veronica moves. Randy seconds. Any discussion about the appointments? Any need to go into executive session? Randy?
I just want to say that all very qualified people, we're lucky to have them. So
Good, thank you. Or either one. Either way, you guys. Okay. Okay, very good. So let's have a vote on the advisory board appointments. Mike Sigler, Randy,
Dan,
Yes.
I don't think we got motions.
did we not move?
We did.
Yeah, we did, I
You did,
think.
okay.
Veronica, then it was me.
Veronica moved and Randy
Yeah.
seconded.
Okay.
That's okay. No, thanks for checking me. So we are having a vote. Mike, Randy, Veronica,
Yes.
Travis,
Yes.
and I am a yes. That is unanimous. Thank you, everybody. So I'm just going to pause for a second. This is my brother, Jerry, that just came in the room. And my brother-in-law, my sister-in-law's brother-in-law, Mike, who is a lifelong, born and raised in Tompkins County. And Jerry, just while we're on the record, I just wanted to apologize officially for taking those stamps from you when we were a kid. Those yeah. Thank you. Now it's on the record. So.
District is your,
Mike grew up in my district. Yeah, lucky Mike. All right. Thank you for letting me do that personal pause there. All right, we're still at 5-4, so we have a little more time before we're going to officially start the other discussion at 4. So this is a good time to catch up on any department updates that we haven't gotten to yet. I see we have Brenda here. Is Frank? I don't know if Frank is here also or no? Brenda, hello.
Hi there.
What do you got for us
How is
from
everyone?
Health Department.
I don't have a whole lot. Harmony and I have been working on the last joint meeting with public safety and with Zoe, trying to put some of those pieces together for a report back to you. We are currently looking at a grant and hope to submit, it's due this Friday, so it's a very short turnaround on health equity and overdose. So I'll hopefully have more of a report on that for you next month.
Very good. Thank you. Brenda, no, I'm sorry, I'll leave it at that. Does anyone have questions for Brenda? Okay, and then Harmony, did you have anything to add to that? Or I know you're not exactly the same department yet.
No, I think that's a pretty good summary. We're still collecting information. There were a lot of questions asked of us, and we've been reaching out to a number of people and should have more information for you soon.
Very good. Thank you. Any questions for Harmony? Okay. Let's see. We have Kate Shanks booth, County Youth Services. Kate, do you have anything for us?
Yeah, thanks. It's good timing. I just wanted to follow up a little bit with what Brenda and Harmony were just saying. At the last meeting, I wasn't able to be here, but there was the Community Coalition for Healthy Youth, which is CCHY, was mentioned. I just wanted to reiterate that this committee is still meeting monthly and has been for a while. The current partners are Alcohol and Drug Council, obviously our youth department, TST BOCES, the health department, Cornell Cooperative Extension, Catholic Charities and Advocacy Center. And so they had a retreat this past, I think it's been probably about a month and a half ago, and they've regrouped and had a couple of goals that I just wanted to share with you guys. First one is that they want to increase the perception of harm of marijuana for youth under the age of 21. And one of the strategies of that is to have some town halls and campaign awareness around fentanyl and some of the unregulated sales of drugs for youth. And so I know that fits in. And so we've reached out to Harmony and Brenda, and we're going to be working with them on that. And then also to just decrease the access to nicotine and vaping for youth as well. And so and then the other thing that comes out of this, and has for a while, every 2 years it's now known as the Klein survey. Was formerly the Community Music Care Survey that's given to every 7th through 12th grader in Tompkins County. And so it's obviously a collaboration of all those community partners, but it is something that comes out of that. So it's an active group, and we're looking to see how we can tie in with some of the questions and conversations that came around fentanyl and some of those unregulated sales of drugs. So I just want to put that on your radar and let you know that work is still happening, and that we're working with them. So.
Thank you, Kate. Any questions for Kate? All right, excellent. Ken Clark, Office of Human Rights.
Okay, good afternoon.
Afternoon.
Just one update I wanted to share with the committee is that OHR has been working along with the Human Rights Commission and representatives from a number of nonprofit organizations to develop a civic education project we plan to launch in the fall. It's going to be focused on the rights and responsibilities of citizenship, empowering people to understand what their rights are and what power that they have in the community, but also the importance of voting. We've begun to discuss target audiences and discussing strategies and priorities. Our intent is to really center the voices and experiences of our audiences. And we also have discussed an effort to encourage voter registration in a nonpartisan way. Several of the groups involved, along with the commission, include the Dorothy Cotton Institute, which really provides, through the legacy of Dorothy Cotton, the premier model for civic education. The League of Women Voters, the Alliance of Families for Justice, the Ultimate Reentry Opportunity Initiative, Rejoice to Vote, which is an initiative started by Jeff Furman, the Finger Lakes Independence Center. We will be asking the Board of Elections to come to our next meeting. And we've had a couple of very productive meetings and want to look at also hosting, sponsoring a monthly event which will be focused on these particular issues. So that is something that we plan to launch in September or October. and to carry that on in some ongoing way, even beyond the midterm elections. So that's my report.
Well, thank you, Ken. Any questions or comments for Ken? All right. Thank you. Thank you.
You're welcome.
I think I got all the department heads are here. Did I miss anybody that's on the screen? Okay, good. Let's do the minutes approval and then we'll jump into our next big topic. Is there somebody that will move the minutes, please? Veronica moves, Randy seconds. Thank you. Any discussion about the minutes? Okay, let's have a vote then. Travis?
Yes.
Veronica?
Yes.
Randy?
Yes.
Mike?
Yes.
And I'm a yes, so that's unanimous. All right. We are ready to move into our next presentation and discussion, and I want to repeat a couple of things that I said at the beginning of the meeting. One is that what's going to happen, what I would like to have happen at this meeting is that this is a presentation and that we are going to ask all the clarifying questions we want. We're going to make sure we understand what's in this proposal and what's being asked of the county. But I really want to try to avoid discussing the merits of tides, right? This is not quite the moment yet we are not ready yet to decide if we're going to do this or want to do this, whether we should do this. That's not quite ready yet. What will happen after the presentation is we're going to take a couple of minutes to talk about next steps. And I'm going to recommend that the next step for us is that we ask our county administrator to convene a meeting with all appropriate county staff that might be involved in this project for them to take a lot of time with the proposal and really look through it more thoroughly, prepare some responses and some ideas for us, the legislature, and report back to us next month. So that's what I'm going to propose. So if you haven't heard that already, you can mull that over for the next little bit. I also really would like to do our best to end this meeting at 5 o'clock. Last time we had this tides discussion, it was at least an hour and a half. The more I think about it, I think it was like an hour and 45. Let's try to keep it to an hour and see if we can get done at 5 o'clock. So those are my introductory remarks. If the tides folks would come on up to the desk, please, and choose unless there's a specific spot they should be, or can they just sit anywhere they want?
Tag.
Yeah, anywhere you want. And last time we started with Cynthia Brock. She was kind of like the lead presenter. So Cynthia, I'm going to turn over to you, and then we can do introductions of everybody else that's here, and you can figure out how you want to proceed from here. Sound okay?
Yes, thank you. I wanted to thank the Health and Human Services Committee for inviting us to speak with you today. I will begin by introducing my colleagues in this effort. Carmen Guidi, who is the founder of Second Wind Cottages, Chris Teitelbaum, the Regional Director, Fort James St. John's Community Center, George McGonigal from Common Council, Rich John and Travis Books, who are county legislators, Jerry Dietz from CSP Management, Nels Bone from the Ithaca Urban Renewal Agency, and I'm Cynthia Brock, member of Common Council. Since we last presented to you in May, our group has been joined by Frank Krupa from the Department of Health, who was asked to join our group by Shauna Black. We also have David Shapiro, who is the new executive director for Second Wind Cottages, and Jason Demarest, who's an area architect. You know, we all wear many hats, and our volunteer group first came together in February in an effort to propose new approaches to support those living unhoused in the city of Ithaca. Last February, Carmen and Deb Wilkie invited George and me to visit those who were living unsheltered in the snow and ice. As you recall, February was exceptionally bitter, and the night before our visit, the temperatures had dropped to 15 below zero. The men and women that we met were cold, they were scared, and they were physically and emotionally overwhelmed. That week, I put out a call asking for individuals to help develop a plan because the undeniable fact is that our current approach, the approach of the city and that of the county, is failing in its effort to adequately serve those living unhoused. That failure is evident not only in those just struggling to stay alive in the winter, but also with the growing number of individuals who are chronically cycling in and out of emergency shelter in the winter and into unsanctioned encampments in the summer. So we are here as a group because we strongly believe that the critical step towards helping those living unhoused is to both A, create and support the development of a low barrier sanctioned encampment site, while also B, expanding the supply of permanent supportive housing and transitional housing for those experiencing unsheltered homelessness. These concrete steps are necessary to steward people into a path of safe, stable, supportive, and permanent housing. While we as a group are here to talk about creating sanctioned encampment sites, the focus on expanding permanent supportive housing options must continue lockstep with this work. Our group has met with the City Planning and Economic Development Committee twice in March or in May. And then on July 20th, we met and we urged the PEDC to declare that a sanctioned encampment site serves an essential government function. We asked them to undergo a process to select a city site, to allocate city support, and to develop an RFP or RFEI to select a contractor to manage the site. In your packet, you will see that we provided the city with a sample RFP as well as a conceptual budget for a potential program that our team has envisioned that we call TIDES. In order to help address the cycle of homelessness in the city, we have also become to recognize that the approach to stewarding individuals from unsanctioned encampments into shelter, whether the shelter be a sanctioned site, emergency shelter, supportive housing, that's a matter of policy to be determined by local governments. Travis, Rich, George, and I provided an outline of what that stewardship policy might look like. And all in all, the PEDC was supportive of our suggestions, and they will actually be, we will be discussing this Wednesday, the mayor's proposed next steps. The agenda is online if you want to take a look at that. Anyway, today I've been asked to outline what a creation of a sanctioned encampment site means for the county and what its impacts will have on services, costs, and policies. To begin, we ask that the county expand the continuum of care to include sanctioned encampment sites in their strategy of support to those living unhoused. In terms of services, we urge the county to see a sanctioned encampment site as a focal point for county services, to use this opportunity to examine the efficacy of the services that are currently being provided, not only to those who are eligible for DSS services, but also to those who are outside of the system and hardest to reach. By creating a safe and central location that serves everyone, outreach workers will be able to reach more people and connect with them consistently over time. Right now, a lot of time is being spent traveling to and from secluded locations to hopefully connect with individuals who have not been able to access services. To hopefully connect with clients who may or may not be there in environments which may or may not be safe for either the client or the outreach worker. We believe that a low barrier sanctioned encampment site will create new opportunities to connect with those who have not been able to access services in a way that we are unable to do so now. We believe that when properly supported, which with wraparound care, a sanctioned encampment site will help foster stability and trust, build community and support, and create an environment that will help individuals build the skills and the confidence that they need to successfully break the cycle of returning to homelessness. In the PEDC agenda, you will see that the mayor has proposed a work plan to respond to our request and the Tides proposal. This work plan includes the city working with the county to create a coordinated approach, perhaps through a shared housing navigator position that could provide intensive case management to help those establish a path to shelter. In terms of funding, the mayor requests the creation of a working group of city and county officials to develop a potential conceptual funding model for establishing and maintaining sanctioned encampment site to be done prior to the city issuing an RFP. And in terms of protocols, the mayor requests that the city and the county continuum of care work together to assist the city in developing a model protocol to guide the public response, including notice and support, should the closure of established encampments be necessary. Just to wrap up, we're about to go into the cold winter season in a few months. As people move into code blue, encampments will clear out. And if no action is taken, come spring, those encampment sites will become repopulated. It's time for a new approach. And we're here to ask for your support and happy to answer any questions you may have.
Thank you, Cynthia. Before we dive into questions, I just want to mention that some of what Cynthia just talked about with the mayor's work plan, we just got today. I just forwarded to you all about 2 hours ago, 3 hours ago. So you may not have seen it. That's, it's brand new, hot off the press. So that may or may not be part of this discussion, but I just wanted to make you aware of that's a new thing that's shown up. Okay, questions, comments about this big topic? Mike.
I have a bunch of questions, but I'll ask a couple, and then if other people want to jump in, and then we'll go from there, I guess. I guess my overall question is, what makes this different than a shelter? I mean, we keep calling it an encampment and things like that. Why wouldn't we just call it an outdoor shelter? That seems to be what we're talking about.
Kind of looking to Chris to answer that question.
Yeah, I was trying to figure out if I should just speak or raise my hand or something like that. Hi, good evening. I think there's a couple things that make it different, and I think there's a couple things that make it different in how it's used. Right now, the shelter has what some people call a certain barrier to entrance. You have to be approved by DSS. We have a contract with DSS to provide shelter services in Tompkins County. There are individuals who, for whatever reason, are not able to get that clearance to get approved by DSS. They may be on sanctions. They may personally not want to follow the rules of a shelter. There's numerous different reasons. I think another thing is right now we have a population, as Cynthia alluded to, who are quite used to they almost have a culture, if you will, of being in the encampments in the warmer months, and then in cold blue, which, as you may know, is state money in the colder months, and then going back to the encampments. But that's kind of how they're living, which is something we kind of want to help them break right through this proposal. But there's a lot of differences, especially in how it's run and how you would gain access. So both in the rules being approved by DSS and so on. So someone in the encampment could be there, be safe, be a recipient of resources, but not necessarily have to deal with the barriers of coming into the shelter. And in fact, maybe later may come into the shelter, right? Once they're able to do that. But right now, these are we're talking about two different environments with two different levels of sort of the obligations for entrance.
That kind of dovetails onto my other, I'll ask one more question and then we'll circle back to me if you would, Dan. I keep hearing this low barrier to entry. How low is the barrier? I mean, is the low barrier really no barrier? Because that's really what it sounds like, it's no barrier.
Yeah, Mike, I think you're on something there. Is we really want a space where individuals can be, if they, I think, are willing to follow the basic outlines. Now, remember, this group has not come up with what the actual running of the encampment would look like, right? That's a later step, right? For anyone who answers an RFP. But I think I can speak honestly when I say you're really talking about a barrier of just, can you cohabitate with other individuals safely? Right. I think that's really probably about where we're talking. Very, very low barrier. Maybe not even paperwork. Not having to jump through the hoops that DSS requires, which also, are state hoops. So yeah, I think it's really, can you cohabitate with other individuals in a safe manner would probably be the bottom line.
Rich, go ahead. I would just add to what Chris said. I think there would also be some structural differences from what we have right now, in that there would be some control of garbage and outdoor drug use, that would not be something that would be allowed. What's going on inside the cabins would not be policed, but there would be some structure and some level of rules at Tides that does not exist in the current environment. Is that fair, Chris?
I think I would, I think generally though, I think I would shy, I use the all-encompassing sort of, can you live with other human beings? Because I think there's some really, some conversations out there about, would there be some policing of drug use if you're staying on the steps of your cabin, right? And you're smoking a joint. Would there be policing of things which happen every day on the streets of Ithaca? I don't know. And that's something I think would be decided by whoever answered the RFP to the city and county satisfaction. So they won the contract, if there was a contract, and how they decided to manage it inside. Clearly behavior that was dangerous to other human beings would not be tolerated.
And before we leave this shelter question, is it true that in the current shelter system, people have to leave during the day?
So in the shelter itself, if the weather is nice outside, we do urge individuals to leave during the day. If an individual has a reason for not leaving, which, and I will admit this is somewhat subjective, that we believe is a legitimate reason, this might be mental health issues, mobility issues or something like that, then they'll be asked to occupy the Friendship Center or the back area, which is part of the Friendship Center, but not be in their room or in the aggregate or the congregate, the congregate care setting area, which are sort of our open dormitory. If you're at a motel, which are quite honestly harder for us to police, I do know individuals will sometimes stay there all day. And so on. But at a shelter itself, we do urge individuals to utilize the Friendship Center or to go out and sort of get business done unless they have another reason for being there.
So is it probably fair to say then that that's another bit of a difference between what envisions Tides and what a shelter is?
I think that's very fair. Yeah, that Tides would, or encampment you had, people would be allowed to be there all day just as if they were at their campsite.
Okay. Thank you. Mike, I know you have a lot more questions. We will get back to you unless you have another shelter question, like a follow-up.
No, please.
Okay.
I don't want to monopolize the time either.
We'll get to you, I promise. Veronica.
Thank you, Dan, and everyone else. I understand we're not debating the merits of Tides right now, but clarifying what the ask is from your group to the county, I think. So in that vein, I see there's a piece of asking the continuum of care to sorry, what did you say? Like come up with a plan for what if an encampment has to get shut down? But it's my understanding that the continuum of care has its own, and this is something I'm not an expert in, like its own, research-driven practices on how to, deal with like unhoused and unstably housed people and what things are helpful and not. And so it's at best odd to me that this proposal seems fair, I know there's a lot of questions in it, but fairly robust for something that doesn't seem to have maybe had their input that much going forward. So I know this is sounding more like a complaint, but my question is, can you clarify, you're asking for the community continuum of care's input, but to what extent are you open to folks working within that who are maybe not part of this working group? I know there's some overlap. Driving the decision-making of the basic structure of Tides versus planning for this one little eventuality of what I'm hearing is if Tides were to get shut down.
Let me try to address that because I think the mayor's work plan is the reference for developing a protocol, kind of a best practices protocol for how to provide notice and support in the event that the city decides there's a need to clear an encampment. So that's not part of the Tides proposal. That's part of the city mayor's work plan proposal. And I think that the idea is to get input from the continuum of care staff and work with outreach workers to figure out what is that best practices protocol in that event. That's the goal, as I understand it from the mayor's perspective. I don't think it's necessarily referencing if Tides is closed down. I think it's more focused at unsanctioned encampments.
Okay. Oh, sorry, I did misunderstand then. Is there a reason that you're only asking for continuum of care input in that aspect and not in the aspect of Tides itself, the meat of it?
You would have to ask the mayor.
I think that the mayor's work plan does not necessarily make assumptions about Tides. It's still agnostic on whether Tides is the right next step or not, but the Planning and Economic Development Committee did strongly support moving forward with Tides.
I want to make sure Veronica's question got it. You're asking, has the continuum of care been involved in this process, and are they going to be brought in more? Is that kind of the gist of your question?
I kind of.
I have a clarification
Yeah.
that might help. We have consulted with outreach workers, including the people who are involved with the continuum of care, and received input. I think it's a given among all the people working on Tides that you would need all of the outreach worker capabilities from all the different agencies that are involved right now to make this successful. And there would, if your concern is that they would be shut out and not involved in the planning of Tides, that's not the intent at all. Is that what you were asking?
That is what I'm asking. I guess my concern is that that's already happening. So I respect that that's not the intent. Maybe to be more concrete, I think, did someone say that the mayor was looking to put out an RFP for this instead of an RFEI? So
That's undecided.
I think it's undecided at this point. The majority of the members of the Planning and Economic Development Committee encourage moving forward with an issuance of an RFP. I think the mayor has now issued a proposed work plan, which maybe takes a step back, that there's a number of questions that need to be answered before there would be an issuance of an RFP or an RFEI. So I think that that's still yet to be decided where the mayor's position is on that question.
Okay, I see hands, so I'll leave
Thank you. Should be able to get back to you. Travis, you're up.
I was going to respond. I didn't have a question. I'll pass.
Okay, thanks. We'll get you back when you're ready. Chris.
Yeah, I think to clarify a couple, I'm sorry, it's for the legislator who's just speaking.
Veronica.
Veronica, thank you. Per Veronica's question, a point or ask for clarification. As I understand it, and through my work with the continuum of care being sort of HUD driven, does not really view encampments as a solution to homelessness. This group does not view encampments as a solution to homelessness. I think one of the real points of clarification here that's really important is that unless the county, state, or city are going to pony up $300 million tomorrow to build new housing, which I would put that down as an ask. I think that would be great. It'd be great if y'all did that, but I don't think you have the means to, right? So unless that's going to happen tomorrow, the issue of folks living in unsafe encampments is still going to exist until we get that housing. I think as per Cynthia's original point was that the scope of the continuum of care's sort of oversight be expanded to actually include encampments as a stopgap between being unhoused and then being housed, as a legitimate sort of stopgap. I do believe, and Cynthia can correct me, but I do believe that was the point of it, so that we can actually work with the continuum of care in a very robust manner. And to your second point really quickly, I think a lot of people think about Tides as Tides is the encampment. It isn't. Tides is a group of people who came together to say, hey, we think there's an issue here. We'd like to bring it to your attention as legislatures. Whoever wins the RFP will then have the responsibility of putting together a group, including hopefully people with lived experience, both currently homeless or unhoused and previously homeless and unhoused. People, I hope, from a wide spectrum of folks to figure out what the management and rules and so on of that encampment would be. I simply stress that because all that's up in the air, right? All Tides is doing is saying, listen, we see a problem. We'd like you as the county legislature and also the city council to please get together and figure out a way to solve this problem. And here's a solution that we think is good for you.
Okay, let's circle back around. Mike, you ready for some more?
I am.
Go for it.
So I want to come back to that low barrier. I've been told that, of course, I mean, low barrier. Are you not going to be doing any background checks for that? I mean, I don't see how you would be able to. Number two, considering that means you're going to have sex offenders living here, does that mean the city is going to be comfortable with this being men only? I mean, will women be allowed? Will children be allowed? I guess that's my next question.
I guess saw Travis's hand go up and come back down. So right now, Mike, sex offenders are not allowed in the shelter. We have a site where we house sex offenders. I'll just keep that to myself. But we do segregate if someone is a sex offender. In the encampments, you have sex offenders. You have sex offenders who are known by parole to be there. They're visited, as far as I know, by parole and so on. You have women in the encampments. You hopefully do not have children. There have been occasionally children coming through the encampments, and luckily our very robust response and support system in the county has been able to respond and sort of make sure those children do not stay there. But I think in any encampment, you will have to accept the fact that you will have sex offenders, you will have women, and so on. And hopefully whoever wins the RFP, if one is put forward, has a policy in place to keep an eye on all those folks and keep all those folks safe. I will stress, and I do sound like I'm sort of being a proponent for this for a second. I guess I am, 'cause I'm on the group. Is I think it's better to have all the people you're concerned about for whatever reason in one spot than spread all over the place where you're trudging through creeks and tall grass and other things to sort of get to them.
Well, it kind of brings me to my next question too, is, I mean, so you're going to, I guess, I don't know if there's going to be vetting or not, but let's put that to the side for now. How long will somebody be able to stay in the encampment? I mean, once you get somebody into a cabin, they're going to feel like it's theirs. So how long do they get to stay there?
Again, I think that is up to whatever group would win the RFP to come up with that policy in accordance with outreach workers, with the shelter, with other folks to try, because obviously the goal is to get them into housing. How long that takes, I don't know. I think I would refer back to how long are people staying in the encampments now, and hopefully a shorter amount of time than they are right now. I think you're winning if it's a shorter amount of time than they actually are staying in the encampments right now.
Randy.
Yes, thank the working group for taking this on. I think it's a challenge, but it needs to be taken on. It's been ignored for too long. The one question I had is looking at your schedule of when you were hoping something would happen. When are you thinking that something would actually happen there? What's your dream for when it would happen? So.
Rich, go ahead.
Yeah, I think there's a case to be made for some real urgency here. One is, since a year ago, the number of people camping and the neighborhood impacts of the camping have grown substantially. What we're seeing right now are some pretty severe economic impacts in the West End. We're seeing businesses leaving and other businesses contemplating leaving. This is the sales tax engine for the county in some measure, and we're hurting it. There's also impacts on the residences. We've seen a steady stream of reports from the residents in Nate's Floral Estate, where they have been subjected to a steady stream of thefts. Recently, one of the residents there was attacked by a dog. These incidences don't seem to be, they're trending up. is what's going on. I also think that we have, as Cynthia alluded to, the issue of this winter, that's the time to get tides built out, if it's going to get built out, so that we take advantage of the period of time when the camps are emptied. I also think that this is a project that would be worthy of consideration within our recovery fund. And that's coming up very soon. It would be a shame to leave it out of contention to file a grant because we didn't go fast enough to make a decision. So there's several different reasons. It would be nice to take a lot of time to think about this, but I don't think we have a lot of time. Thanks.
Yeah, I'll just jump in and get back to you in a sec. Is that, because maybe you haven't had a chance to look at it yet, the mayor's timeline that just came out today, it's got a timeline in there that stretches through March. So she's proposing something that's going to last a little longer than this winter. Randy, do you have any more questions for now?
Just a point in a question, I think for you, Dan. A month ago, we had the crisis stabilization discussion, and there was a grant program for that, and it had to do with mental health. A lot of people that are in these encampments, mental health is a big issue, alcohol, drugs, and we didn't get that award, I believe, but we're still allocated, right? Isn't it still a system that's going to be offered to Tompkins County, but through the county that got the award? How does that work?
Harmony, are you still on the line here?
Yes, I'm on the line. Yeah, it's a regional award, and Chemung County was the county that was the recipient of the award. The challenge, however, is that, there's significant transportation barriers. How are you going to get people that far away to Elmira to get those services? And there is another grant opportunity, RFP opportunity out there for a lesser crisis stabilization center called supportive instead of intensive. It does not offer the medication component, but it does offer a supportive place for people up to 23 hours. So we are exploring that. When I say we, the hospital, Cuga Medical Center was the organization that was seeking that RFP along with Alcohol and Drug Council and Cuga Addiction and Recovery Services. So it's not off the table completely yet, but it is considered a regional model at this point for Office of Mental Health.
Thank you.
I just want to mention that we're 4:30 right now. We're doing really well. We're getting through a lot of stuff. Thank you for moving swiftly through these questions and answers. We're covering a lot of ground. Let's keep going. Veronica, do you have more questions?
Not at the moment.
Okay. Travis, you got anything yet for us? It's okay if you don't.
No, not yet.
Okay. I know Mike Sigler does. Keep going.
I always do. Would the city be inclined? Does this need to be a coordinated effort between the city and the county? Or would the city pick the spot and the county go ahead and do it? I don't know if that's too broad a question.
I don't know that anyone here has the authority to answer that.
Want to say a little more what you have in mind, what you're thinking? Or not?
Well, I don't want to say that this isn't, we're mixing responsibilities of two separate government agencies, and I don't know if that's wise. And my other question is, we're putting a lot of weight. I mean, is the sheriff on? I don't even know if anybody from policing is on. So, because I know IPD is away, but I don't know how to phrase this. I mean, we have Art House, for example, and I know you don't want to get into discussion. I don't know how to really
Thank you
phrase
for
it.
tiptoeing.
I know, I'm trying to reel it in. You have Art House, which has troubled folks, I mean, who have mental health issues and have all these issues, and we're not able to take care of that now. And I just don't understand how something with a lower barrier is going to work.
Well, that's a really good question, Mike. So in this situation with our house, you don't have a person that was hired to provide services directly to those folks. In Tides, the whole idea is to provide services directly to those folks. So it's a much better model than taking people who have had historic issues and saying, here, we're going to move you over here, but we're not going to give you the help that you need to make this transition successful. Tides is saying, we're going to move you over here and give you all the help that you need to make this transition successful and hopefully transition you out of here to permanent housing, right? So that's the point. The folks from mental health that provide mental health services can go to the encampment once, twice, 3 times a week, whatever that looks like when we figure it out. And am I frozen?
Oh, you're doing good. We hear you.
All right, cool. And they can go and provide services to folks in a safe environment and not have to go to encampments, be engaged with folks in unsafe environments, not necessarily have to rely on the residents of Tides to come to them, but they can go directly to those folks and provide those services. So in many ways, it's a much
There was a short freeze.
But now I can slip in this question. Because I guess this is where you're losing me, because I don't understand why we can't do that right now. Like, we know Art House is there. We know who in there is under services, who I think our people are going there now. But are we saying that our people aren't doing that?
So how many units do we have for our house, Mike?
I have no idea. I'm sorry.
Can't be more than a dozen. We're talking about a dozen units. We're not talking about being able to move 50 folks into our house. Look, at the end of the day, Tides is one of the solutions to a much bigger problem. It's not the end all be all. You have to have Tides. You have to have the units at the Art House. We're going to have another solution or 2, maybe 3 or 4. This is a part of the solution. This is not the solution.
Can I insert?
Hang on one sec, Chris. We got.
Yeah, so Mike, one other observation I'd like to make is that while I think there's a feeling that this is a city problem, it actually is a problem that is now creeping into other parts of the county. So I'm surprised that the legislature or this group hasn't heard from other communities. I know it's in Lansing, I know it's in Newfield, I know it's in the town of Ithaca. There is evidence of homelessness and encampments happening there. So it is a problem that is getting outside the borders of the city of Ithaca. Just want to.
Just to clarify, that's not really what I mean. I mean, it's actually a county responsibility, not because it's creeping out into the county. I mean, even if it was just in the city of Ithaca, housing is our deal. It's not the city's deal. So I just want to clarify that.
And just to be, I don't want to put too fine a point on everything that's considered. We're not creating housing. This in no way is, I don't think anybody in our group considers this housing. Right, this is shelter. You were closer to the point when you asked about shelter. But I think this is a shelter that has the ability to create community amongst a group of people that have a wide range of needs, but has that ability to properly manage to create a community.
I had Chris next, and then I'll get you Cynthia.
If I'm understanding Mike's concern or point about the mixing of the two governmental entities, I think right now, if we're going to have some type of encampment succeed, you have to have representation from both sides. Some of the folks who are on the forefront of sort of assisting homeless folks are IPD. That's a city entity. They are of great assistance to the shelter, right? They've done some really great work. You have the business downtown, the people, staff, the people who provide services downtown in the city. So the two entities are it's a shotgun wedding, if I can use that term. There's no way to get away from it. The county right now provides or underwrites some amazing services through outreach workers and so on. But I don't see any way in which the two entities could make this work without both being at the table. In fact, I don't see how it could work without the whole county, people from Lansing and so on being part of the conversation. I think the other thing really quickly that I'll get to, Mike, that I think you're getting to, is that we have a lot of individuals who would benefit, I think, from an encampment of some sort, who are so far removed from being neighbors, So one of the things that happens, you had a wonderful building our house put up, and then people moved in who just had no idea, quite honestly, how to be neighbors, right? They were used to living just on their own rules. Something I think an encampment can do is actually sort of be I forget what the term for it is, but I'll use the term in the idea in the armed services. When you leave the armed services, there's a period of time that's expected for you to reacclimate to civilian life. I think there's a lot of folks who are 2, 3, 4, 5, 6 years homeless, who may be generationally homeless, who need a space where they can sort of reacclimate to civilian life, to being good neighbors, before they go into some place and get blacklisted by a landlord, right? Get kicked out, get an eviction on their record, and so on. I think that's another thing that's not really talked about that an encampment could really provide, is providing a transfer space, if you will, for individuals to come in, get services, get used to being near other human beings, and being part of a community, right? Anytime you have a place of humans, you grow a community. So Tides would become a community. And hopefully people would use it as one from which they transfer from homelessness into being housed and being good neighbors and contributing to wherever they are eventually housed.
And I know I have a couple of people lined up. I just want to remind everyone, we are here to make sure we understand all the details of the proposal, what's being asked of the county, and to ask all those clarifying questions. Let's keep going. Cynthia.
Thank you. Yeah, I'm going to follow up on where I think Mike was going. And I like your thinking, actually, right? These responsibilities dealing with homelessness, providing mental health services, getting people into housing, these are county responsibilities. Why is this proposal based in the city? Well, I think first and foremost, when we think about care, we think about meeting people where they are. And right now, most of them are in the city. And we were looking around. I spent a lot of time, my colleagues will tell you, looking around at sites, at maps in the city. Where could something like this be, where these people are? And so we ended up focusing on a city property, by which case we need city approval and city support to allow that land to be used for this purpose. But there are growing encampment communities in other municipalities. They will also need a space where they are. If you look around at models throughout the US, they're not always on government-owned land. Some of the land is private land, donated land, old parking lots that are utilized as campgrounds or festival lands that are used for this, where other communities have tried to come up with this solution. Does the city necessarily have to be the provider of this land? I don't think so. There might be other options out there, but of course, for any private property owner to donate that space for an undetermined period of time is an expensive proposition that might be unrealistic. But could be done, could be purchased, it might happen. So if the county wanted to explore that and take the responsibility entirely within the county jurisdiction, I would applaud that effort. We came up with this because of where we were, because of the community that we were trying to support and trying to provide something for them where they were. But I do think that as this issue grows in Tompkins County and throughout the nation, other models and other locations will need to be considered.
Yeah, I've got Rich, then Lisa. Yeah, Mike, you make a really good point. Where do you draw the line on responsibilities between the city and the county? In our discussions, we've thought there's such great impacts at both the city and county level, as well as the towns now and villages, that there's a role for each to play, but that's undetermined at this point. And if you look at the memo, the asks of the county today are 3, 4, and 5, or basically we need to go to the city and start talking about how this would fall out in terms of responsibilities. I think that's an urgent step, and I would love to see some resolution on that even today to say, let's start talking to the city on these issues. Maybe you'd think that's premature, but given that I see this as at a crisis level,
those discussions probably should have started some time ago. But what's the answer to your question? I don't know. Not yet. I mean, but we should really try to get there. Thanks. Lisa Holmes.
Thanks, Dan. And I wanted to thank the group for bringing this forward and elevating this issue for discussion. My question had to do with the approach of a sanctioned encampment versus low barrier shelter, and why the approach of a sanctioned, why you went with approach of sanctioned encampment versus asking for more low barrier shelter capacity in town. I'm just curious and wanting to understand that.
Was interested in answering that one.
Nels is looking at me, I'm looking at Chris.
I can't see Cynthia, but I can sense that she's looking at me. I think I think Kit's here as well, if Kit wants to chime in. The county through DSS has certain obligations in bureaucratic steps they have to take, right, for someone to get approved to come to the shelter, right, with us as a contractor to them to provide shelter services. The term low barrier is I gotta be honest with you, Lisa, I'm not sure what it means. It means something different to everyone, right, depending upon where they want the barrier to be. It can be nothing, no holds barred. It could be maybe you just write your name down. There's a number of different things, but from the shelter point of view, as someone who works for the county via DSS, we have certain obligations, right, that the person be approved by DSS. Now, do we occasionally shelter folks that we think are very much at risk while we try to shepherd them through that process? Absolutely, that does happen now and then. But we just can't unilaterally decide, hey, we're gonna not do process A, B, and C, or fulfill requirement A, B, and C. So I hope that kind of answers it. One, we don't know what low barrier really even means. And number two, we just have sort of those requirements via the county via DSS for sheltering folks. Kit, do you want to add anything?
So thanks, Chris. I think when it comes to low barrier, there are shelters in the state that OTDA recognizes, and I think this is some of what you're talking about, Chris, is that low barrier can mean lots of different things. I think OTDA does recognize certain shelters as low barrier shelters, and that means that when they are recognized shelters that are approved by OTDA, that means a social service district can actually approve somebody to utilize funds to live there. That's not something that I think this encampment will provide. I don't think that social services funds through the state will be able to be utilized for people to reside there. And the one question, again, I think as we've had this conversation, we need all kinds of support for homeless people. We've seen the numbers rise tremendously. I don't have a great sense about or I don't have a way to really weigh in, I don't feel like, in terms of what this encampment will provide to us and what it won't. I think that the one concern that I have, being in charge of a social service district where we see that when people are not approved, and it can be kids that get out of detention and the state is saying they can't stay there any longer and they get dropped off on our doorstep, or whether it's somebody who's coming through the parole system and they get dropped off on our doorstep because they're released and parole says, we don't know where they're going to go, do something for them. One of the concerns that I have about this proposal is, what do we do? I know that the goal is not to incarcerate, which I totally support, not to incarcerate people who are homeless. But if somebody is not compliant, and they are residing at Tides and they are not willing to comply with regulations or willing to apply for services, which is how DSS works. We can't just place people, they have to apply. I know that we don't have a desire to arrest people. So what does happen to those folks? We may be in a situation where they decide, I'm not staying at Tides, I'm gonna go live on a different plot of land in the city, and we can move them, but or the police can move them, but I do worry about what will happen. But beyond that, I think that this has the potential to support some people, but it won't be something that DSS can support, through our programs.
I would just mention that as I think about this and have talked with people, that's come up a lot. Like, why not? People often say, why not a hotel? Why not get a big hotel? And I mean, one answer I've got is that I think it's a lot more expensive than what's being proposed. And another is the location. This is where people are right now. And so this is a solution for the location where many people are in the encampment right now. Okay, I've got Randy. We've got Ithaca Fire Chief Tom Parsons here. Tom, I'm going to line you up in a second if you want to say anything. If you don't, that's fine as well. And then we do need to start winding down this discussion. Randy, you're up.
Thank you. Rich, I agree it is a crisis. And there are others, but this is definitely one. The question I had was more about Ithaca, and I think why it does make sense that it's the first project is in the city of Ithaca. That's where most of the population is. It's closer to services. Obviously, Lansing, you got the South Lansing Center buildings, which have been empty for a decade, which could hold 100+ people, and it was housing, but it's been empty for a long time. TC3 has many apartments. I think over 100. They're empty, been empty for a couple of years. But again, they're separated. So there is housing out there that is empty right now if we got real desperate. So I just wanted to share that.
Chief Parsons, do you want to weigh in at all? I know you've been listening to all this.
Yes, I've been listening. I'm sorry for the background noise. I think that having been involved with the issue of homelessness for pretty much a decade, the challenges are how do you get people to move into housing who are not ready to move into housing? They have, there may be social issues where they can't get close to folks. They don't like living to have neighbors. And then there are some who actually get into housing and there are rules that they have to abide by, and then they choose that they don't want to abide by the rules. And then we have unsanctioned encampments that people can move back out into. And I think it's been a revolving door for as long as I've been fire chief. One of the things that we don't want to end up having to do is keep kicking the can down the road. The city's made several efforts over the last decade to relocate people who are homeless to different parts of the city. There was a lot of concern about the area behind Agway. So the city made an effort to move folks out of that area. The city cleaned up the area. They end up moving down into Southwest Park, in behind Lowe's, in behind Walmart, and they established encampments down there. We go down into Southwest into different homeless encampments almost every week for either fires or medical emergencies. There's a lot of crime and violence going on, and it's just it's not getting better. I think Tides is a great concept. I think it's definitely worth trying because what we found out with Art House, where folks moved into Art House, they were not prepared to live there, and there was no real support system to help them. And I'm not sure that some of those who were there who have moved out would be able to go back again, just because they've kind of lost their invite, so to speak. So I think Tides is an absolutely an essential step to get people towards more structured housing, and it's a step in the right direction. The one thing that I am concerned about is if you establish a sanctioned encampment and don't do something about the unsanctioned encampments, will the structured and sanctioned encampment fail? Just because even if you have the slightest rules, some people may say, I don't want to live there, I want to live someplace else. So that's a concern. And lastly, I will say, I know the comment was it's a city problem, but if the city was to find a developer to redevelop a lot of the land in Southwest Park, we'd end up relocating these folks, and they may not be able to live on city property. They may be moving on to land that's out in the town of Ithaca or farther away from services, making it more difficult for the service providers to reach them. So I think you have to look at the pros and the cons of doing something. And at this point, I think what's being proposed is it's worth a pilot project to get it off the ground and see how it can be successful.
Thank you, Chief, and congratulations on your upcoming retirement. You're in your last couple of weeks, right?
Yeah, 6 more days.
6 more days, all right. Congratulations. Okay, I'm going to go with Travis, and then I'm going to ask this conversation be over. We're going to spend a few minutes, a few quick minutes to talk about what the next step for the county is. There's obviously, more and more to talk about, but this is not the end, clearly. And we can always call and email each other and answer more questions and have more discussion. So we're not even close to the end yet. Travis, I saw your hand up.
No, that was Chris's hand.
Oh. Okay. Well, Chris, then you get the final say.
I just want to insert that one thing that I think is important, because people keep bringing up Art House. Most individuals, once you do wraparound services, right? Our wraparound services are almost entirely voluntary, and I think that gets lost sometimes. So you can move in someplace and people say, here are your wraparound services, and you can say, no, thank you, I'm closing my door now, right? And the problem stays the same. So sometimes I think folks just need a place to comfortably and safely sit while they get ready and used to services. I think that's really important to keep in mind. So the reason why Art House, those folks in Art House did not do well is because they did not accept the wraparound services and were able to close their door because they had tenancy rights. Thanks.
All right, so I had just asked to wind this up. Is there any last minute things that need to be
How is this different? I mean, you just opened a big door.
It's different in that you have a place where people can sit without getting in trouble with landlords. They can still get services. You can still work with them, getting them toward being accepting of those wraparound services before you put them in some place, and then they just blow up gloriously and fail because they're not taking the wraparound services. Like I said, sometimes people need a place. You need a parking spot sometimes for humans that's safe and comfortable for them while they get used to being around other humans.
Okay, thank you. So we've heard a lot, and obviously there's more to hear. I believe that the county needs to huddle among ourselves and figure some of this stuff out. What we think of this, what we think we're capable of and want, could, and should do. So our county administrator, Lisa Holmes, has suggested, and I think it's a good idea, that the next step would be for her to convene a meeting of all the relevant county staff that might be involved in such a project, and for them to really go through the proposal and really examine it, ask the questions, answer what questions they can, and then come back to this committee. So I wanted to ask the committee members, does this type of approach sound acceptable to you? Veronica is shaking her head yes.
We'd like to add an amendment.
Yes.
Travis is saying yes. Randy's got his hand up. Go ahead, Randy. That's a yes? Go ahead, talk to us.
So I think that, as the working group here did, they were meeting weekly, right? A lot. And I think that it's important what Lisa said, and I agree with that. But I think that if you're going to really dive into it, it should be more often than once a month that we meet again, and that some legislature should be on some of those working groups. So this is my thought.
Okay, Mike.
I have an amendment to your recommendation.
Go ahead.
I don't know if it's really something that would work in parallel. I'm looking at this and I'm just thinking you're putting the cart before the horse. I look at this as a mental health care issue and an addiction issue. And we keep saying that we're going to have somebody at this camp for wraparound services. it's 50 people. One person caseworker is not going to do that. Frankly, I think we need a mental health crisis center. And I think Holly, she's still there. Yeah, we lost that one grant. It was $300,000. I think the county should put up that $300,000. And we need to put the mental health service in place before we go and we take care of the housing. Because it's not housing. We're putting them in place, hoping that they're going to go get these wraparound services that frankly, I don't know if they exist. We're saying kind of like, well, they were at Art House and they didn't have access to these services. Yeah, they did. We were sending people to Art House and they didn't take the services. And I don't know how putting people in just another building where they're not going to want the services either, perhaps. It just seems to me like you need the mental health care first, not the other first. Because otherwise I don't know what to do with them.
So what is your amendment?
My amendment would be that if we're going to task our county workers to do this, how much would a mental health crisis center cost? Like, can we do that? Frank Krupa, working with the hospital, how much would it cost? Where would we put it? How many beds can we do? Dutchess County already does this. What does theirs look like? And if it's $10 million, hey, it's $10 million and I'm kind of down with that. But I don't have any of those questions. And if we don't have that part in place, I can't see doing the 1.7 million or whatever we're doing over here. So
Mike, the reason that I think that I would like to go the way that I suggested is because we have a specific request being given to us right now, right here. And we need to respond one way or the other. And I don't know how else we can respond unless we go through some process similar to what was outlined. That doesn't mean we can't also do what you're saying. I have no objection to that at all. But right now, this request is being presented to us from the city and we need to respond. And I'm looking, if you have another way that we can respond, I would like to hear it. I guess that's what I'm saying. Like, why not?
I would add that to the request. If you add that to the request, then maybe I can go. I mean, if we're just asking to look into it, that's fine. But I can't vote for something that doesn't have a solution. You're going to house 50 people. Well, there's 80 people there now. And if you're trying to tell me we're going to go and rip that woman's house down that she's built on the inlet, I call bullshit. We're not doing that.
Lisa, would you like to weigh in on this at all, or you don't have to if you don't want? I don't want to put you on the spot.
Well, what I'm thinking is that in the discussion with county staff, we can bring up and explore the points that Mike is raising in terms of mental health services, crisis stabilization, and so we could incorporate that into the discussion when we pull staff together and come back to you with that in addition to the other points about tides. If that would be helpful to move this discussion along and to hit on those points.
Like, is that basically what you're asking?
Pretty much, yeah. I mean, I think of it. Yes, that's what I'm asking. We'll just stick with that. And
okay.
There.
Well, then that sounds good. I want to go back to Travis and Randy and Veronica and see if that still works for what you have. And I know you asked for a different thing, Randy. We'll get to that in a sec.
Yes, that still sounds great.
Veronica, Travis?
That's fine.
Okay. Randy gives a thumbs up. So, okay, and the last little thing then, Randy, you had said that you would like to see legislators involved in this. Is that's basically what you said?
Yeah, not in the initial point, but I think that, it is a very complex issue and there's going to be a lot of questions and I want to be informed. I don't want to wait once a month to be informed.
Okay. Lisa, do you want to address that point at all or it's up to you?
Sure. I hear what you're saying, Randy, and I'm thinking at least for this initial discussion and pulling together the group with the staff and the legislators, we'll be asking some of these very pointed questions about the impact of moving forward with a sanctioned encampment on services and staffing and costs and impact and all of those points. Probably, we could probably address that most effectively with staff and bringing it back to the committee for input. Where we go from there in terms of if further discussion, if people have questions at the next Health and Human Service Committee meeting, and we can have those departments come to that meeting and you can ask specifically of those staff, and we can take it from there if that's acceptable.
Randy, did you want to respond to that, or you don't have to?
Let Travis ask a question first.
Okay. Travis, go ahead.
You know, I do know in our discussions of the Tides Working Group that one of the next steps would be for that group to kind of go away, and for folks from the legislature, Common Council, staff from both the city and the county, hopefully would form a new committee where we would be continuing to work on this. So I don't know if that helps with what you're asking, Randy.
Yes, it does. And I'll go back to what Mike was talking about mental health. And I realize that social services is really burdened with a lot, and they've got limited staff to do things. But I worry about the services of or adequate services of mental health. But I really believe in going to where the issue is. And I'll give you an example, something I learned today, which I think is great. I found out that Tompkins County Mental Health is going out to Newfield School twice a week now to help with mental health for kids. I had no idea. I'm thrilled. But just knowing those things is really important, because if it wasn't happening, I would have been more upset. So I think mental health is a big deal. And so that's my number one issue. So.
Lisa, I wanted to ask you, we're obviously about to enter a very busy period, the budget period, not that we're not busy now. Is it realistic that you could pull this meeting together in the next month before the next HHS committee meeting?
Yes, I believe so. Yes. We can
Excellent.
make it a priority.
Okay, thank you. All right, do the committee members feel like we've gone about as far as we can right now? Leave it here. Relatively satisfied that we can leave it here? Okay, any last business before this committee? I want to thank the members of the Tides Working Group that were here today to participate in this robust conversation. Thank the committee members. Katrina, thank you for holding down the fort over there. And if there's nothing more, then we're adjourned. Thank you, everybody. I can't believe how out of line that was.
I need to jump. The FCC, it was appropriate. I need to jump right into another meeting.